my name is Gemma Davies and I am a tissue viability specialist nurse and have been for around 10 years now. So and I most recently took over the role of clinical lead for Telford Wound Healing Service, and I really wanted to come to talk to you today about how our new service has really transformed the lives of people living with chronic wounds. So transforming wound care delivery obviously is crucial, and we've heard a lot about why we need to make changes. We've heard a lot about the work of Julian Guest, and we've talked all about how we need to look at new models of care in order to maintain a sustainable NHS, really, and a sustainable future. So previously, I'm going to cover with you the new care model. So previously in the area that I work, patients with chronic wounds, ambulatory patients, would have been to visit their practice nurse. And so we looked at how we could change that model and how we could improve the care that those patients receive. So firstly, we'll have a little look at that. Secondly, and I guess the burning question really is, did we make any difference? So we started in April of 2018, so we're nearly at the end of our first year. So we'll have a little look at whether actually that new model that we implemented has made any real difference. And then thirdly, I want to just share with you a case study, just to really illustrate how our new service has impacted on one particular patient. So if we have a look at the model that we implemented, like I say, these patients were ambulatory patients living with chronic wounds who normally would have visited their general practice. And the new model that we looked at was that these patients would attend specialist bespoke wound healing clinics across the locality that we worked in. So they would be looked after in 7 clinics across that locality by specialist nurses that with one primary focus. And we've heard a lot, haven't we, around why it's important for people that know what they're doing, that are able to do an accurate assessment and diagnosis and then implement a treatment plan. So I'm not going to have time to go through all of the models, so I've picked out some of the key focuses really, and I want to start with the capacity plan. We've heard a huge amount today about the challenges that we have with this never-ending supply of patients, and there just doesn't seem to be a stop tap, does there? They just keep coming, and the population is ageing, and we're getting older, and we're having more prevalence of people living with chronic wounds. And so one of the real beauties of our model is that it was based upon a capacity plan. There was some pre-audit work done with the GP practices to really try and understand the prevalence of people living with chronic wounds in our area. And based upon those findings, the CCG commissioned our service based upon the required need. So we do work to a capacity, and when our service is full, when we have used our appointment slots, we don't have to take on any more patients. And whilst there are parts of that feel challenging, because we know there are patients that are still out there, at the end of our first year, we are just about on the cusp of no longer having a waiting list. So that's really positive. Because of that, we are able to really provide a standardised care and a standardised approach to assessment, treatment and diagnosis, and of course using evidence-based care at really the core and the forefront of everything that we do. And that again is really fundamental to the care that the patients receive and the outcomes that then we see. Early intervention. So, our patients attend on their very first visit. Most of the patients that we see, around 90% of the patients are leg ulcers, but we aren't a leg ulcer service, we are a chronic wound healing service, so we do see all wound types. But for example, if a patient comes with a leg ulcer, they have, a full holistic assessment, including, ABPI, TBPI, whatever it is we need to do, and referral onto the appropriate people. That collaborative working has really been essential. We have got amazing links with our colleagues in podiatry and vascular services. We are building links, we are forming new links. Only at this conference did I really get to know the new tissue viability lead for the acute trust, and we know that we've got work to do, but I think that the building blocks that we've built so far have really been amazing. And I would ask you to question whether you really do collaborative working. Just because you know your podiatrist and the patient visits both of you, are you actually working collaboratively? So we have planned for next year joint meetings. Podiatry is now going to be part of our new wound healing centres that are being currently built in our area for us. So, really think about what actually is collaborative working. We won't cover the final sections, but of course they are crucial and important to the model. So that's the model. But I suppose the burning question is, have we made any actual difference? So what I wanted to do is just give you a rough example of some data. So we are in the process, of course, of looking at our end of year data, and as part of that, we looked at the first 100 venous leg ulcers to heal. So the first people through the door that went on to heal. And the average length of time that the patients had their venous leg ulcers before being referred to our service was 40 weeks. Now, what I want to point out with that figure is that's not the healing time. So at 40 weeks, those patients came to our service with non-healing chronic wounds that they had already had for 40 weeks, and many of them were deteriorating. You know, that's flabbergasting, isn't it? That's amazing. So what impact have we had on that? So we then looked at the healing outcomes, so our healing rates. And I think it goes without saying that all of those patients, those 100 patients that lived with their wounds for 40 weeks, healed on average within 11. And I think, you know, that data's crucial and of course justifies our service, but it's not just about healing outcomes. So we also want to consider and factor in improvements to patients' quality of life. We want to look at those 11 weeks that they live with that wound is still 11 weeks. And so how is their experience of living with a wound enhanced and improved? So just a few examples really for you. You're all angels and I wouldn't be here if it wasn't for you all. You know, when somebody says that to you and you really truly believe that they probably wouldn't, and they admit to you on their first assessment that they considered taking their own life, you know, that really is to me more beneficial than the healing outcomes. A patient that was able to go out for lunch with her brother for the first time in 9 months. I go out for lunch with my sisters and my friends every weekend. I can't imagine not going out for lunch for 9 months. And she now has a pain level where she feels she can leave the house and go out for lunch. So that's really, really, you know, really crucial and keeps driving us forward. The other thing, which is a little bit of a coincidental finding really, and whilst I sort of, as a tissue viability nurse for all these years know that if we improve patient outcomes and we improve patient experience and we improve patient healing rates, you know, that's great, and I had no doubt that our service would do that, you know, I believed in it. I didn't quite realise the impact that it would have on myself and on the staff and the team that I work with. I asked my staff to do some staff stories. So we hear a lot about patient stories, don't we? And actually I thought, you know, let's flip this round. We need to see what impact this has had on the team. And one of my members of staff, within her staff stories, one of her questions, replied that her current job, in one word, was incredible. I think that's brilliant. Another member of staff was actually due to leave the NHS. She was disillusioned with the rat race that we're in. She didn't feel that she had time to care. She felt she came in as a district nurse with her 20 visits and barely saying hello and goodbye to the patient, and she just thought, this isn't for me. She's now with her, she's developed, she's a band 6, she's started her prescribing course. You know, recruitment and retention in the NHS are a real challenge, and so for me, this has been something that I think really we need to focus on. And due to that, the team are inspired and engaged and passionate, and I think that has had a real impact on the positive outcomes for the patients. So we've looked at the outcomes. So I think let's have a little look at one of our patients. So we have our Betty. Now she isn't Betty, but I'm sure most of you will have heard of Betty's story. If you haven't, have a look at Betty's story. It's an NHS right care scenario that really sort of encompasses everything that we do within our service. I think, you know, we have 100 Bettys and 100 Brians in our service, but this is just one of them. Now, she was a 92-year-old lady, and she came to our service under a little bit of duress, I would have to say. She was a challenge. She wasn't one for change. She quite liked toddling off to see her practice nurse twice a week. She was quite good friends with her, and she quite liked her simple dressings, and I think she thought that was her life, that was her lot. But she didn't go out any time other than that. She only went to see the practice nurse because she didn't like her smelly wound, and she was a bit embarrassed by it, and it was a bit painful. So, holistic assessment, ABPI, and actually she was referred over to the vascular services, and it was identified that she had mixed etiology ulceration, so she did have some arterial element and a reduced ABPI, but she was suitable for reduced compression, and more than happy to continue to come to us after the first time she'd met us, so much so that she comes most weeks now with a box of chocolates. But she's healed at 37 weeks. She's just celebrated her 92nd birthday by going to the Tower Ballroom in Blackpool with her family because she loved to dance. And I think that really does illustrate you know, a real life story and how that really improved her life. She's 92 and she's now making lasting memories with her family. On a personal note, despite all the challenges that I've been faced with over the last 12 months, I can honestly say that it has been the best 12 months of my career ever. I am proud to be part of Telford Wound Healing Service. I'm proud to lead a team of passionate, engaged clinicians and to have made an influence on delivering amazing outcomes to both my team and my patients. It's been a blast, to be honest, and I'm really, really looking forward to the challenges that 2019 will no doubt throw me. Thank you.